Share on Pinterest if you're self-conscious about having low or barely visible cheekbones. You may be considering cheek fillers, also called dermal fillers. These cosmetic procedures are designed to lift your cheekbones, add volume to your face, and smooth fine lines and wrinkles. Cheek fillers are becoming more and more popular, but they do carry some risks of side effects. This article will answer your questions about what cheek fillers cost, what the procedure is like, and whether cheek fillers are right for you. What are cheek fillers? Cheek fillers are injections that raise the volume of the area above and around your cheekbones. This provides the illusion of a more defined bone structure. By injecting volume under your skin layer, cheek fillers can also smooth out wrinkles and fine lines. Types of fillers. There are several kinds of materials that are approved for use in cheek fillers. Hyaluronic acid, Juvederm, Restylane, and polylactic acid, Sculptra, are two types of dermal fillers recommended for use in the cheek and under eye area. These types of dermal fillers are temporary. Other fillers, such as Radiesse, hydroxylapatite, are also used off-label for this area. How long they last depending on the type that you choose. Cheek fillers can last anywhere from 6 months to 2 years before results are no longer noticeable. The dermal filler material eventually dissolves and metabolizes into your skin tissue. Who's a good candidate? If you're a healthy non-smoker without a history of chronic health conditions, you may be a candidate for cheek fillers. Per the Food and Drug Administration, FDA, guidelines trusted source, you should avoid getting cheek fillers if you have bleeding disorders or allergic to the synthetic compounds used in dermal fillers or pregnant or breastfeeding. What's the procedure like? After a consultation with a trained provider where you discuss pricing, cost, and your desired results, you'll schedule an appointment for a filler injection. Procedure prep. In the 2 weeks prior to the procedure, you'll need to avoid taking any blood-thinning medications, such as aspirin. If you're on prescription blood thinners, let your provider know at your consultation meeting. They may give you additional guidelines for how to prep for your filler appointment. Procedure steps. During the appointment, you'll recline in a sterilized environment. Your doctor may apply a topical anesthetic to the injection site, or there may be a numbing agent already mixed into the filler itself. The injection process should be simple and will only last 20 minutes or so. After the injection, you'll be able to see some of the results immediately. It will take a day or two for the filler to settle into its position on your face. You can drive after the procedure, and you can even return to work or other appointments immediately after. Recovery. During the first few days after an injection, you should avoid sleeping on your cheeks. Try to sleep facing up, flat on your back. You may also want to avoid strenuous exercise until the filler has completely taken its shape, 48 hours after the injection procedure. Avoid touching your face, and keep your face clean and dry as much as possible until the risk of infection has passed. What are the benefits of cheek fillers? Compared to other treatment options, such as cheek implants and surgical facelifts, cheek fillers have several obvious benefits. Cheek fillers can be performed in a plastic surgeon's office and require little or no anesthesia. Recovery for cheek fillers is quick, and many people can go right back to work or their regular activities afterward. Cheek fillers last for months or years, but the result isn't permanent, so if you change your mind about them, you aren't stuck with the result. Cheek fillers carry a very low risk of serious complications or infection. Cheek fillers can be modified after insertion, meaning that you can add more filler to the injection site until you achieve your desired result. Cheek fillers are less expensive than more invasive plastic surgery for making your cheeks appear more defined. Are cheek fillers safe? Cheek fillers are a low-risk, fairly straightforward procedure with minimal recovery time. but that doesn't mean there isn't a risk of side effects. Common side effects of cheek fillers include swelling, bruising, itching, redness. All dermal fillers carry a slight risk of an allergic reaction or an infection. Other less common side effects include filler leakage, tissue death due to circulation blockage, injury to your veins or arteries, vision loss. There's also the risk of injection material migrating to other parts of your face, causing a lumpy or asymmetrical appearance. If this does happen, your doctor may inject another material to dissolve the filler, or simply wait for the filler material to metabolize on its own. The risk of rare side effects is higher if you use an unlicensed or inexperienced provider. How much do cheek fillers cost? The cost of your cheek fillers will depend on what type of dermal fillers you and your provider decide on, as well as how much of that material is needed. Hyaluronic acid. According to the American Society of Plastic Surgeons, 1 syringe of hyaluronic acid filler costs on average around $682. Polylactic acid. Filler options that last longer, like polylactic acid, cost more. They come in around $915 a syringe. Fat grafts. Grafting fillers, which are the most permanent form of dermal fillers, are the priciest. They cost an average of $2,100 per syringe. Cheek fillers are an elective cosmetic procedure. That means the cost won't be covered by your health insurance, even if you have no copay and have met your deductible for the year. How do I find a provider who does cheek fillers? If you're thinking about getting cheek fillers, finding a trained provider should be your first step. Using a discounted or unlicensed provider significantly increases your risk of complications from dermal fillers. To find a licensed cosmetic surgeon in your area, you can start by searching the American Society of Plastic Surgeons website database. Take-away cheek fillers are a relatively simple cosmetic procedure. Results can last anywhere from 6 months to 2 years. If you want to be pleased with your results, it's critical that you find a provider who's experienced and licensed in performing dermal filler injections. There's some risk of serious complications after cheek fillers, so make sure to speak to your doctor about the procedure so that you know what to expect and how to best avoid infection.